How does Medicaid spend down work for retirement care? Imagine having enough savings and income to cover your health care needs, but then facing a big medical bill that pushes you over the Medicaid limits. How can you still qualify for Medicaid long-term care coverage? That's where the process called spend down comes into play. Medicaid spend down is like a deductible in insurance. When your income or assets are higher than your state's Medicaid limits, you need to use the excess money on qualified medical expenses to become eligible. Think of it as paying your way into Medicaid coverage by spending your extra resources on necessary healthcare costs. Once you spend enough to meet your state's threshold, you qualify for Medicaid for the rest of that period. Each state sets its own income limits for the medically needy pathway. Usually, for individuals, this limit is less than $1,000 a month, but it can be higher for couples. For example, if your monthly retirement income is $800 and your state's limit is $300, you need to spend $500 on medical expenses to qualify. The goal is to reduce your countable income to or below that limit. The spend-down process works in specific time frames called budget periods. For long-term care like nursing homes or assisted living, the period is 6 months. For other Medicaid groups, it is 1 month. During this time, you gather medical bills and receipts. When your documented expenses surpass your excess income, you become eligible for Medicaid. For example, if your 6-month period runs from January to June and you meet your spend-down amount in March, your Medicaid coverage begins on March 1st and lasts until June 30th. Not all medical expenses count towards spend-down. Only costs related to health care qualify. These include prescription drugs, unpaid medical bills, nursing home costs, home modifications like wheelchair ramps, transportation to doctor visits, and other necessary health services. It's important to keep copies of all bills and receipts because Medicaid will not reimburse expenses that you have already used to meet your spend-down. Your income sources that count include Social Security benefits, pensions, distributions from retirement accounts, Veterans Affairs benefits, wages, and alimony. The state Medicaid office reviews all these sources when calculating your spend-down requirement. In addition to income, there is a rule called the look-back period. It examines your financial transactions from the past 5 years to prevent asset transfers at less than fair market value. If you have assets above Medicaid's limit, you can spend them on allowable items to meet the asset limit. But you need to be careful because improper transfers can lead to penalties or delays in eligibility. Some states have exemptions or special rules for certain transfers, so checking your state's specific regulations is a good idea. From a retirement planning point of view, understanding spend-down helps you manage long-term care costs better. If you have savings or income that initially disqualifies you, spend-down allows you to access Medicaid coverage by using excess resources for medical expenses. Working with a Medicaid planner or local agency can help you stay within the rules and avoid penalties. Always ask your local Medicaid office or caseworker for guidance tailored to your situation. This way, you can protect your retirement savings while ensuring you get the care you need when the time comes.